Ultrasound as a technology and a radiology entity has been around for a long time. So point of care is a little bit different in that it's actually in the hand of the physician taking care of the patient. So you see what you're seeing in real time, from diagnosing shortness of breath to clots in the legs to skin infection, abscess. So over the past 8 years, it's been an area that I've spent a lot of time on, both in learning for myself and teaching it to others, thinking about other creative ways of teaching this, and then trying to help other people and places start programs on their own as well. I'm here at Weill Bugando to see how point-of-care ultrasound is being used and see if I can help them build that up a little bit. Part of this trip is talking to some of the Cornell physicians who are here, who are familiar with how things work. And part of this is really involving the residents and physicians here, right? I mean, I guess the goal is to empower them a little bit that they can go and take the next step, right? They don't need me to hold their hand. I just need to show them not to be afraid to learn this on their own. I think once you have the basic skills, then there's a lot of self-education that can happen. I think that anytime you go outside to another institution, to another country, it gives you ideas of how things can be done differently. So I think there's mutual benefit that they gain a little bit from how I approach a certain case and vice versa.